The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. And Dr. David Schwietert practices in Rapid City, South Dakota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome. I'm Dr. Jerry Lala.
I'm Dr. David Schwietert.
And I'm Dr. Richard Jensen.
And we welcome you to this dimension of House Call. Thank you for inviting us into your home. And we're going to talk today about the early warning signs of osteoporosis and things that you can do to prevent it, even if you have a genetic predisposition to it, as well as treat it now. And of course, we know that there's osteopenia, which is a precursor to osteoporosis. And then if it's not stopped, then it turns into osteoporosis. So let's begin with a review of some of the early warning signs. One of the primary things is loss of height, loss of joint ranges of motion. I know every patient that I see, I probably never miss doing this, is I always check their spinal ranges of motion and their lower and upper extremities as well. So loss of joints and ranges of motion, postural abnormalities, including things like such as a head tilt or a shoulder tilt. The shoulders or head becomes tilted. There's a dowager's hump or a buffalo hump that develops in their lower neck and or upper thoracic spine. We call that a hyperkyphosis, or a rounding of the shoulders. Also, there would be unresolved joint pains involving the spine, lower back, neck, mid-back, knees, legs, feet, ankles, shoulders, arms, or tissue degeneration problems, sprains or strains, slow healing of strains or sprains. Another early warning sign of osteopenia or osteoporosis is constipation as a result of bone loss. If I'm losing bone, we're constantly losing bone from our calcium from our bones and rebuilding those bones. So it's modeling and remodeling all of the time. That's if we're healthy. But if that calcium is being excreted in excessive amounts, it's going to certainly impact the stools, causing constipation. Another early sign of bone loss or osteoporosis is loss of hair and or changes in natural hair color, the density of hair, also affected by deficiencies of amino acids or proteins. So changes in the thickness, strength, texture, and color of the finger or toenails. When that happens, it's indicating that protein and electrolytes, which are minerals of which nails are composed, are deficient, not in proper biochemical ratio, and or not being digested, assimilated, or utilized correctly. And when that's the case, the finger and toenails will be affected, and so will the hair. Now, our esteemed colleague, Dr. David Schwietert, is going to take us on to cannibalization.
The next thing that happens is organ failure, aging of the skin, such as wrinkling or sagging, loss of tone, shape, or the size of muscles is an indicator that the body is cannibalizing itself. It does this by eating into stored protein in the muscles and organ tissues. Fatigue-related anemia. The blood does not transport adequate amino acids, electrolytes, fats, vitamins, minerals, and carbohydrates in them, so fatigue would be another indicator. Dr. Jensen.
Thank you, Dr. Schwietert. We also find that there's muscle aches, pains, cramps, Charlie horses, restless leg syndrome. How about dysmenorrhea or menstrual cramps, indicating that the muscles are not receiving adequate amounts of electrolytes and proteins. Mood swings, indicating that the brain may be deficient in electrolytes. In addition to other biochemical needs, electrolytes are needed by the brain for nerve transmission. Well, point 12, we have arthritis. Calcium is being deposited on the outside rather than on the inside of our bones and our joints. And arteriosclerosis with calcium infiltrating the cholesterol plaque that has accumulated on the inside of the arteries. Dental decay, where calcium is lost from the teeth and weakening in their structure.
Now that could also be in children too, the restless leg syndrome and the
Yes.
other. We could see that in kids.
Definitely, we see a number of patients that come in of all ages that have restless leg syndrome. And so calcium and loss of electrolytes can be a great contributor to that
Now,
that
can
case.
diet throw those electrolytes off?
Oh, certainly, certainly. I mean, you can look at from what you drink and through what you eat.
Well, what does soda pop do?
Soda pop with its phosphoric acid, it takes calcium to get rid of phosphorus. And so by drinking soda pop and having the phosphoric acid, which is what they use now for the carbonation, is they will, when you're drinking that, you have to get rid of that phosphorus somewhere. And so it gets taken out in the kidneys. And to use that, it's got to use the calcium to buffer it and join with it, and so that it can be excreted. Also, you have problems with, say, high protein diets. High protein diets, protein contains, I mean, in the DNA, in every cell within that, there's phosphorus inside of that DNA, inside those proteins, and so therefore, in order to get rid of that, it's also going to take away calcium. So even with high protein diets and things like that, you also need calcium due to that diet as well.
So people that are on Atkins or some of these other new diets today could be putting themselves at risk if they don't know what their calcium levels are?
Right.
Certainly.
If they're not managing that diet correctly. Let's see, you have the beautiful x-ray up here where the calcium was building up on the outside of the bone.
Certainly, right here we're seeing a case where we have calcium building up outside the bone along in the vertebrae here. We have
This is a side picture of the lumbar spine?
This is a side picture of the low back. And you can see this is the vertebrae that I've outlined here. But what they have is in between both these vertebrae is a disc in that space. And you can see inside that space the nucleus pulposus of the disc. It's kind of like the jelly inside of a jelly donut that fits in between there. That takes the extra pressure. That's actually calcifying in there. And then the ligaments that join these two together, there's calcification going along across that. So there's a lot of calcification going on here.
The calcium's going on the outside of the bone in soft tissues rather than being deposited on the inside of the bone.
Absolutely. And so what this is an ankylosing of this, or it's creating a arthritis.
So does that then, can that occur in other soft tissues like arteries?
Certainly, and that's what we're seeing over here with all the arrows pointing to it. This is actually the abdominal aorta. It's a major vessel of the heart that carries all the blood through your trunk to your legs. And what's happening here is we've got calcification forming on the outside of this artery here. And what happens is sometimes this is hardening of the artery, and people, when we find this, it drastically changes how we adjust the people, because you don't want to transect an artery like this that's hard like that. So the twisting and so forth is not how we adjust that. These
So
people,
when you're talking about adjustments, you're talking about people going to a chiropractor
and not
getting manipulations or spinal adjustments, and they have an undiagnosed atherosclerosis going on
Certainly.
in either the abdominal aorta or in the vertebral arteries or carotid or subclavians in the neck, right?
Right. And so these are people that, if they go to a chiropractor and he doesn't take the adjustments,
You mean take the x-rays?
or take the x-rays, it's leaving you wide open to these dangers.
Right.
Another thing is if this person was in a car accident and took a blow to the abdomen, that's the other thing. So when we see this, we tell you, hey, take this straight to your medical doctor. They should know about that, because that's going to be critical care.
Yeah, it doesn't mean that they can't have chiropractic care, but it has to be a very, very mild, non-forcive care.
Absolutely.
What about the arteries?
The arteries? Well, let's look at the arteries here. Dr. Sweetert, you want to talk about the arteries?
I'd love to. What we're looking at is a picture on the left of
The heart?
a fatty, you're right, we're looking at a picture of the heart and of the vessels of the heart, the arteries. And what we've seen is a normal size at the top left, where the cursor is. It should be nice and open.
Be like one of the coronary arteries. Huh?
That's correct. And then on the right side, what we see is one that's occluded, partially occluded, or shut down. And what that has done is caused death to part of the heart muscle. You can see it's just dark and black on this particular, if you have color TV, black on the lower right-hand side.
So when that fat, when there's been an injury and that cholesterol builds up on the inside of the artery, and it isn't stopped with dietary changes and nutritional supplementation, it continues to grow. And so that's when an interventional cardiologist would go in with a balloon, push it back as much as he or she can, and then insert a stent. And of course now they're using stents with drug coatings on them, but they're not all that effective in many conditions as well. So is that a progressive process that we see in the bottom of the screen then?
It sure is. What we see on the left is a normal blood vessel. You can see that it's nice and pink around the outside, and it's in the center it's got a fairly wide opening. And the next picture on the right, we see that there's beginning stages of plaque that it looks like dots along in there, but it's starting to build up within the lumen of the artery. Then we see actual, in the next picture, plaquing in the bottom part, where it's starting to narrow the size of the artery so that
That's where the
occludes
calcium
it.
is starting to fill in.
That's
and the
right.
plaque.
It gets hard and stiff, and calcium is plaquing up in there. And then on the right side, you can see that it's about 50 to 60% occluded, where a large amount of plaque, large amount of calcium is being laid down and deposited.
So that's then called a thrombi when it's still adhered to the inside of the intima of the artery.
Yep.
And if it breaks loose and starts floating, it's called emboli.
That's right.
Okay.
And if that emboli gets up into the lungs or it passes into the brain, you die fairly quickly.
An interesting thing about this over here, where we're talking about with the occluded artery up in here, and where they've had a problem with the heart over here, where it's occluded there. A lot of times people will have these small cardiac events, and many times they think of it as acid reflux. Many females have that, and they think it's acid reflux. And in fact, when you go into the hospital and you say, "Oh, they think they have to determine whether you're having a heart attack or acid reflux." They have this nice little cocktail. It's like milk of magnesia kind of thing. You drink that, it takes any gastritis away immediately, any symptoms. And if it's still there, they know they got to go in and check the heart. And what happens here is you can be killing off this heart muscle all the way through until finally there's a major cardiac event. The next slide here, again, it's showing the disease progression, and we're going to go into this a little bit closer now. What we have here is a regular artery, and that regular artery, we have what we call the inside layer or the intimal layer here. And many times the macrophages out here are here, they're waiting to see. What they do is they're an immune function cell, and they're like scavenger cells, and they take stuff out of the blood that's not supposed to be there. The thing is, they're in the wall of the artery, so if there's stuff that's going through the blood that's not supposed to be there, as they take it in, they're actually closing off that intimal layer. As we see in this next slide, it starts to build up with the cholesterol. And so when we have that buildup of cholesterol, later on, calcium starts to go into there. And Dr. Sweeter, what happens when we have that much buildup?
There isn't much left.
No.
The body, if it's happening in the heart, the coronary arteries are not getting blood supply, oxygen, energy, glucose, and so forth to the cells. They're not getting their electrolytes, and that's when we have tissue death. And
And
it
if
just
there's an inflammation of those arteries, say in the lower extremities, it's called thrombophlebitis, right?
Yep, it sure is.
What's interesting is that you would not believe the number of people who have stents placed in their coronary arteries who walk out of that hospital, they're doing fine, it's a miraculous surgery for just millions of people, and then go back to eating high-fat diets. It is high cholesterol diets. It's absolutely incredible. When in fact, you can, by blood testing, particularly blood testing, you can determine the nutritional needs of a person and attempt to put that body back or enhance its health through natural nutrition in either treating the issue when they have it, treating the issue after they've had bypass surgery, or open heart surgery, and or preventing it totally. it's a preventable thing, but still they go out and eat these high-fat diets, and it's absolutely crazy when you could, in fact, have a blood test. The blood test would tell you where your body is internally at biochemical nature, and then get on a proper nutritional program. But again, it should be a science-based program, not something that you pick up at the health food store or read in the Sunday newspaper, or hear some little snippet on some news show that's trying to attract viewers by having a 10-second health spot. Right?
That's right.
So let's move on then.
Well, what we have here is we have a tract that we're
That's right. That'll be excellent. Go ahead.
offering. It's now is the time to build strong bones. Again, we've been talking about osteoporosis, and this being the time to build strong bones. If you call in, we will be happy to send you this information. And it contains, some of the information that we're telling on this show. It's important that you pay attention to your bone health now. It's one of those things that you constantly pay attention to your bone health, because once it starts to go, hey, you're starting the trend, and so now is the time. Now is the time.
If there's osteoporosis going on in the body, you can pretty good bet that there's some arterial or atherosclerosis going on in the body, or vice versa. So go ahead.
Well, let's go back to the next slide and take another look at the effect of this plaquing, the atherosclerosis that's going on within the body. The problem is that this is a systemic issue. It's not just one particular area. It's not just the heart. It kind of reminds me of a patient that I had who had bypass surgery. And of course, now with the stent surgery and so forth that's going on, there's a lot less bypass surgery happening, but it has been my clinical observation over the last number of years that, and this is just anecdotal evidence, I don't have any scientific basis for it, but if somebody has gone in and had bypass surgery, cardiac bypass surgery, in about 3 to 5 years at the outside, they're back in for another bypass, especially because of this particular problem. So we can see this slide labeled atherosclerosis, hardening of the artery. We see the plaque build up, the fat, the lumen is closed down, the opening is closed down, and there just isn't very much of a way for the body to get the nutrients that it needs. It needs a roto-rooter, so to speak, and that's where the nutritional aspect is so very, very important. On our next image here, what we're looking at are various images of cholesterol, fat, calcium, and other types of byproducts that flow down the stream during angioplasty procedure. So you can see it looks like fish and fat and chicken fat and all those other kinds of things in a very pretty picture for sure, but that's what's going on.
We should say that the interventional cardiologist who perform these surgeries, that on the end of that stent and balloon procedure, there's like a little basket there that attempts to collect that debris so that it doesn't go flowing through the body and cause a stroke.
In this next slide, this is what they're trying to get rid of. Arterial plaque that's built up within the arteries. And so this material here, you're seeing it all put together in there. It's the cholesterol, the fat, and the thrombi, basically, that's being formed, the scab that's formed on the inside of the arteries. And of course, that's what they're trying to get rid of within there. Now, in arteriosclerosis, dental cavities, and arthritis, the body is robbing the bones of calcium, which over a period of time predisposes people to osteopenia and osteoporosis. Many of these situations go unnoticed, but eventually have accumulated negative health-robbing effects.
Rich, I got a thought about that. Pregnant women who go through their pregnancy and don't take calcium supplements or have multiple pregnancies over a short period of time, one of the things that I've observed is that their teeth just literally start to fall out. I mean, they just have dental caries, they get soft, they start having gum disease, and it is a real health crisis. And that's why it's so very, very important to have, if you're a pregnant female or anticipating having a pregnancy in your future, that you have a calcium evaluation, because your body is going to rob its stores of calcium and other minerals to build that baby. And your body will be sacrificed for that baby. Good or bad, it's going to pay the
And
price.
she's feeding 2 people, so she has to increase her normal supplementation and almost double it.
That's
so the
right.
baby's getting adequate supplies.
And then it's really disturbing to me as a physician to go out and see these women who are pregnant downing the amount of cola and pop and sugar, knowing full well in my education that they are setting themselves and their babies up for immediate and future problems that they don't necessarily have to have. And that's why we're excited to bring these pamphlets to you. Just all you have to do is call in, get them, and we'll send them to you, because this is the kind of stuff that's going to pay dividends, not only in the short term, but for the rest of your life.
Amen,
Most
brother.
certainly. That's what I was going to say. Amen.
Well, maybe what we should do is we should take a look at the different types of calcium. People are always writing and calling us and asking us for information on the different types of calcium. And there are, in fact, different types of calcium, different qualities of calcium. Some is more absorbable than others, and some has toxic metals to it. And I'll begin here. We'll go right down them. Microcrystalline hydroxyapatite is the best form. Then calcium orotate, or calcium citrate, calcium orotate, calcium lactate, calcium gluconate. And we're really getting down into some very poorly absorbable forms of calcium carbonate, and bone meal, and dolomite. So let's discuss calcium microcrystalline hydroxyapatite.
Before we go ahead, when we're talking about the absorbable forms, I just wanted to show you right here we have an x-ray that shows all these little dots that are in there. Now those dots are actually calcium tablets that have not been broken down in the stomach. So these people are taking basically the supplement that's not being broken down. That's why we come back and say we want to have an absorbable form of calcium, because right here you have evidence before you that's saying that on some of these things, these people, how many supplements did they take over the last few days? There's got to be a dozen there. And they didn't get any of that from there.
And this old wives' tale that some independent food supplement promoters will say, well, put it in vinegar, and if it doesn't break down, it's no good. Well, the pH acidity level of vinegar is far different from that within the stomach with the hydrochloric acid. So microcrystalline hydroxyapatite, it's the best form, it's the most absorbable, it's a complete bone food containing a variety of essential minerals, amino acids, and protein matrix like human bone. Microcrystalline hydroxyapatite promotes increased bone density. It is the best form of arresting bone loss. It is absorbed by poor calcium absorbers, and we don't know, science has never found any disadvantages in taking it. The next form is calcium citrate. It's pretty well absorbed. It reduces the risks of kidney stones. It's generally absorbed pretty good by those with poor digestion, but the downside of it is not a complete bone food. Thus, it supplies insufficient amounts of calcium to the body. So, on the other hand, microcrystalline hydroxyapatite supplies the sufficient amounts of nutrients that the bone needs. So, Dr. Sweeter, could you discuss how about calcium orotate?
Sure. Calcium orotate may promote direct bone mineralization, but it is not a complete bone food. It has a low level of elemental calcium, and many tablets are needed to get enough calcium absorbed. Calcium lactate is well absorbed, but again, it's not a complete bone food. It often contains milk or yeast byproducts, so people who are hypersensitive, which is the majority of adults in Western society anyway, milk are sensitive to milk or dairy products, are going to have problems taking this and set themselves up for allergy and delayed food reactions. Interestingly enough, calcium lactate is made from the fermentation of molasses, starch, sugar, or whey with calcium carbonate added. So, you know, you're getting a kind of an interesting hit there. Dr. Jensen.
Calcium gluconate. Well, it's well absorbed. It contains 9% calcium elementally in it. but it's not very good for corn sensitivity. It's less potential of allergic effects. The source is oxidized glucose from corn to gluconic acid, so if you have problems with sugar, this may give you a problem. Is combined with calcium carbonate and may precipitate low blood pressure or hypoglycemia. So then let's move on to calcium carbonate. Calcium carbonate is by far the cheapest source of calcium. One of the things is it's not a complete bone food. It's absorbed by those with poor stomach, malabsorbed by those with poor stomach digestion, reduced absorption suspect in the middle age and older, and it has an antacid effect which interferes with digestion and absorption. So we think that, you know, maybe some products contain calcium carbonate as antacids. It's not being well absorbed. It's taking care of the acid in there. One of the other things is that this is the form of calcium that's found in those calcium products that we're finding on the shelves, such as coral calcium and oyster shell calcium, is basically calcium carbonate, the cheapest source of calcium and not very well absorbed. Next, we have bone meal. Bone meal, it contains 30% calcium. It contains multiple minerals needed for the bone, but is not well absorbed and can contain toxic metals, herbicides, and pesticides. When we look at the source that bone meal comes from, it comes from dead cows, basically, that they just take the bones and they grind them up and they use them, they sell them as a product. And now think of where the cows got their calcium. They got it from the ground. They got it from grass that may have been sprayed with herbicides and pesticides and that kind. So looking at that as well, that may be building up within the cow and then transferred to whoever's taking that supplement. And then dolomite. Dolomite is usually inexpensive, well absorbed, and a poor source of calcium. It's basically chalk. Dr. Lala, have any further thoughts?
I do. It's a lot of information, and we invite your telephone calls or letters, and we can supply you information on osteoporosis and on calcium. No problem to do that. There's no charge for it. And if you're a believer, then you recognize, or have been at least told in 1 Corinthians, that your body is not your own, but the temple of the Holy Spirit. And even if you're not a believer, still God allowed you to be created, and the better care that we give our bodies, not from a narcissistic perspective, but from a whole person perspective, the greater the likelihood that we're going to have long life and good health. And that's true for unbelievers and believers. It really is. And so the better that you invest in your body, the more that you try to scientifically evaluate the internal functions that you have in your body, the more you'll learn your own individual biochemical nature, and you'll know what foods, if the foods and vitamins, minerals, food supplements that you might be taking are having a positive effect or not. And it will also tell you, in a skilled, scientific-oriented practitioner who's able to identify your blood and tell you what you do need and what is good for you and what is bad for you.
The Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician in care of Dr. Lala or Dr. Jensen at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or telephone us at 651-484-8521, or contact us at the Fellowship of the Great Physician in care of Dr. David Schwietert at 3936 Jackson Boulevard, Rapid City, South Dakota, 57702. Telephone 605-721-3861. Thank you for joining us today.